Hello. Good afternoon, everyone. Good afternoon. I'm just a few seconds early, but I'm going to see if anyone is interested in joining. So I'll wait maybe like a minute, and then I'll get on with the topic so that I'm not holding everybody else's day up as well. Let's see. Let's move that. All righty. So I plan to do these lives every Saturday where we discuss a topic of relevance in both the nursing world, both from the RN as well as the provider side. So I'll start calling it Saturday Scoop and try to put it up on both Instagram and Facebook early enough where you guys can see that it's coming out. So I got a lot of good feedback about what some of y'all really want to see, and it's more of the clinical stuff. But today I want to take the time out and talk about my book, Practice Pearls. It's a little further down my page. When I first started the page, it was because I wrote the book. And I wrote the book basically with the intent of both nursing students who were, not nursing students, I'm sorry, RNs with intent of going to nurse practitioner school, or RNs already in NP school, and novel nurse practitioners. Now, why this book is so special to me, because I've been a practicing nurse practitioner for 7 years now. So it took me about that long to figure out all of the pros and cons of the profession and those things that I should avoid if I wanted to be happy in my profession. Every day is not a good day in any profession, so I'm not speaking of a perfect world sense, but I'm speaking more of things that can have you every day just hating your job, and nobody wants to work like that. So I created a book, Practice Pearls, and it's a comprehensive guide on the conversion from nurse to provider. That was one of the hardest things for me to do as a new nurse practitioner, is the transition from that of a bedside nurse to now as a provider. Hi, Courtney. Thanks for joining. So the school will get you well prepared for clinical stuff in terms of how to treat bronchitis, how to treat a patient that comes into the clinic with chest pain, some labs, drugs, what does what classes of drugs does this, what each body system does. So those are the things that will come with school. What will not come with school will be pros and cons of working for corporate world versus private world. So when I say corporate world, I speak of the hospitals, these large hospital entities that like to call us APPs instead of nurse practitioners, which, I mean, some people don't find anything wrong with that, or mid-levels. That's the word I was looking for. So corporations versus private world. Private world is being employed by a physician or a group of physicians. So it takes a while to kind of muddy through the water and see what are the differences between the two, and they are vast. And some things that you need to avoid in one world versus another world. Elisha, I see you. Hi, good evening. You will know what I'm talking about because I'm pretty sure you went through some of this yourself as a novel NP. So the book strategically talks about the pros of corporate world, the cons of corporate world, the pros of private world, the cons of private world. These are things that have come from my perspective, but trust me when I say I have talked to many, many, many of my colleagues, and just talking to NPs that are not colleagues in the workplace that have had similar experiences, and these are things that are not talked about in the program. Also, how to market yourself. What are these physicians being paid for, these progress notes for these H&Ps? How do I know whether or not, if a physician asks me, do you want to work with a salary or do you want to work per patient? Well, how do I know? What are the downfalls of working for per patient? What are the pros of working for per patient? So the book will give you a little information on all of that as well. Chasing the dollar, that's a big one. We like to go behind that big dollar. Oh, this person is paying me that much. I spoke about a little of that, but the book goes into details about avoiding chasing the dollar. All money is not good money. The book also talks about marketing yourself, of course, safe practice, that's a big one, collaborative agreement, things that you know, things that you don't know when you come out as a novel nurse. You'll know those things straight off that the board will send you. You cannot do chronic pain. You cannot write prescriptions to your friends, but it will not get into the little nuances of what sometimes the physicians will ask you to do that you don't really know if you're supposed to do it, so you just go along with it just to keep the peace. Another thing that the book talks about is how to communicate with physicians where you're uncomfortable about those things that they're asking you to do. So sometimes you know this is not the thing that I want to do, but you don't know how to tell the physician as your boss and the person that creates your payroll check that I'm uncomfortable doing this. Sometimes as a novel NP, you already are dealing with challenges of just knowing whether or not you're prepared. The book also discusses that. What comfort level you'll be in when you come out, what is normal, what is abnormal, fighting through some of the stuff that will be normalcy that you won't think is normalcy. And I'll just speak to that a little bit. I was always a very strong student. I was always a very strong nurse. I kind of went through LPN to RN, so I had a lot of clinical experience in my background. So when I called the physician as an ICU nurse, I already knew what I wanted to do for these patients. I knew what they needed because I watched it day in and day out in a critical care setting. But when I became a provider, I didn't have that security of calling a physician, so it was me. Well, I mean, you have your collaborators, so they are there for you, but some things you'll want to know that you'll feel safe doing, and you won't necessarily feel that in the beginning. The book talks about that. So it talks about how to get through those difficult conversations, how you're supposed to feel when you come out, what's normal, wading through the waters, how to market yourself, how to have uneasy conversations. What are the pros of corporate world? What are the cons? What are the pros of private world? What are the cons? There's so much in that book that the school has not made available to us. And I don't think it's that they don't want to make it available to us, because there's many great things about our profession. But I think it's that we're cramming so much into such little time that the school doesn't have time to talk about some of that other stuff. Thank you, Sabrina. I'm also talking about the fact that when we come out as novel NPs, we have tipped the iceberg, the same as we have done as RNs when we first come out. It prepares us for minimal practice safety. So there are so many things that we don't know that we have to know how to go and get that. The book talks about that. So if you haven't already, I know it's still pre-order, grab your book. I'm going to sign every copy of those that purchased the book and still in the pre-order phase, because those people believed in me, and I appreciate that. So I want you to grab the book because it's going to be very, very, very eye-opening for the new nurse practitioner, and it will be eye-opening for the RN that's already in NP school. It also tells you about what should I prepare myself for to market myself. These things start before you decide what you want to do as an NP. So if you decide as an RN, I want to go to NP school, I'm going to take the family track because I want to be marketable. I want to be able to move around as I did with an RN. If I don't like peds, I could go do adults. If I don't like adults, I could go do ER or urgent care. So it's great to want to have that marketability, but it's also great to make sure that you are preparing yourself to be marketable. You can have a family nurse practitioner degree and pass the boards and get certification of it, but if your background does not show that you are ready for that, you will have a difficult time getting into the market world. Taking a job. So there's a lot of things you can do as an RN, knowing that you're going to go to NP school to prepare yourself for when you come out. So I talk a lot about that. So just a refresher, the book congratulates you on either deciding to go to NP school or becoming an NP. I have definitely worked for the corporate side, Courtney. I've actually worked for Ochsner for 4 years before I transferred over to private world. And there's a lot of vast differences between corporate world and private world. So it's going to be very important that you grab that book, because I have been through both worlds. I've been on the private side for 4 years. I was on the corporate side for 4 years because I worked both jobs at one point because I didn't want to give it up right away. Vast differences in them. There are pros and cons of both. There's no wrong or right answer. It's just always best to be knowledgeable and know which one you would prefer to go into and why, so that when you make that decision, You don't jump into the position and then regret it later, because as a nurse practitioner, and I talk about this in the book, these are not jobs that you're going to do like RN, where you don't like it, so you quit today, give them 2 weeks, and start another job in a week after that. Nurse practitioner job employment, even if you get a job the next week, you may not start for 3 months. You have to go through collaboration with the state. You have to make sure you have to go through credentialing with these hospitals, credentialing with these nursing homes, credentialing with these rehabs. So I wouldn't say a pigeonhole, Nadine. I'm going to use Nadine because Neek, I'm not sure if that's your last name or your first name, or just an abbreviated name. So I don't think it's a pigeonhole. I think it's very good to do something that gives you both worlds. Only problem is you have to prepare yourself. It's not going to be good enough to just have the certification. You have to prepare yourself. It's almost like saying, I've worked as a mother-baby nurse for the last 10 years of my career, and I go to NP school and I do a family track, and I expect to get hired by a family physician or for a hospital working as hospital medicine or in urgent care that does not do peds, because they would feel like you have not had the background to support it. So remember, what makes you more marketable is your background. Everybody has a degree. So we have 4,000 practicing nurse practitioners in New Orleans. I can only speak for New Orleans. 4,000 practicing nurse practitioners. We're all competing for the same jobs. So the way that you never compete, I talked about a little of them, is to always remain professional and to prepare yourself the best you can with your background. Danica. All right. I think I know you, Danica. Actioner, maybe. So anywho, Courtney, I'm going to get back to your question. I've worked both sides. There are a lot of pros and cons. Yes. You work with you as a new grad at Actioner. I wasn't a new grad. Maybe a new grad nurse practitioner, possibly. Okay. So anywho, make sure you know what pitfalls and pros of all the jobs so you can make an informed decision. Grab the book. You won't regret it. If you don't need it, you may have a friend coming out. They will love you for it. Anywho, thank y'all for your time. Does anybody have any other questions? Thank you, Monica. I'm trying, girl. I'm trying. Have a good one.